Okay, so good afternoon to everyone. Welcome again to our class this afternoon for our synchronous session of the pathophysiology. Our topic, our topic is related to the topic 5 on the pathophysiology framework on the risk factors. I know for a fact that sooner or later that you will be preparing for your case presentation and your related learning experience clinical. And one of the parts of your case study will pertain to the pathophysiology. So the finals will cover topics on how you will be guided accordingly to have or rather to design a pathophysiology framework that is very necessary for your understanding and for you to gain confidence as well on the case that will be assigned to all of you. Your professors, I think, have mentioned to me some of the cases that will be assigned to all of you. So please take note of those cases because as we go on with our discussion of the pathophysiology, your assignments will be related on the framework of your cases that will be assigned to your group. However, if the case are given already in advance and you have already formulated your pathophysiology, so most probably our topics that for the final period will guide you accordingly on how you will enhance and how you will improve your framework for your case study or case presentation. The pathophysiology framework is very essential for us to be guided accordingly on the direction on why the client develop a certain diagnosis. We have discussed primarily on the first part of our topics in the preliminary period pertaining to the foundation of the anatomy and physiology and the foundation of the pathology and physiology and combined with the pathophysiology and on how these concepts and principles are very important on the nurse's responsibilities on attending to the health demands of our clients. This may give us also the confidence eventually on how we could answer confidently on some of the medications that have been administered to our clients. And when it comes to the pathophysiology framework, it will always give us the direction on the consistencies pertaining to the data that you have gathered, pertaining to the uh, information on the patient's history, medical history, medication history, and all the diagnostic examinations that have been done to your clients with the results. This data could be useful when it comes to the pathophysiology framework that you will design for your case study and case presentation. And for our topic this afternoon, the primary topic that I will introduce to you is all about the risk factors etiology. So this first part will be the first phase of the pathophysiology framework because this is eventually will validate on how the client had been diagnosed with certain disease, disorder, injury, or illness. And the nurse has a very important role when it comes to this framework, simply because the basic concepts that you have learned actually in the anatomy and physiology will guide you accordingly on why there are some deviations and there are some dysfunctions that the client may have when it comes to the physiologic response on certain diseases or disorder. So our topic for this afternoon is all about risk factors. When we talk about risk factors, it eventually consider the attributes. Possibly it could be characteristics or exposure of an individual that increases the likelihood of developing a disease or injury. This is according to the World Health Organization of 2017. Just like on a typical example, when a nurse attends to a client with respiratory symptoms, so it's the client may not have primarily yet a diagnosis. The client did not are not yet submitted for the diagnostic examination. So the nurse primarily will do the patient history and will specifically consider the physical examination findings. Now, when it comes to the risk factors, objective data, okay, and subjective data is very necessary. However, when it comes to the subjective data, the reliability is being considered for the nurse to have the the data that can be used in the formulation of the nursing diagnosis. In my future discussion also, I may take into consideration the review of how you will formulate nursing diagnosis, which is very essential when it comes to the formulation of your or designing your own nursing care plan and to give appropriate the direction or clear direction on the formulation because of nursing diagnosis because this may primarily has the alignment of the data that we have gathered from subjective and objective data. Going back to the risk factors, okay, nurses are capable and skilled on how to perform physical examination techniques, auscultation, palpation, inspection. So these are skills which are very necessary for you to gather information to eventually record, okay, the real time health condition of the client, okay. But on the aspect that how the client develop the symptoms, how the client experiences some of the manifestations, then we need to consider the identification of the risk factors. Why it is considered as attributes, meaning situations that may consider attributable, meaning situations or factors that needed, okay, that directed the client in the development of the what likelihood on the developing of a disease or an injury. The characteristics may have a relationship, okay, may have a relationship when it comes to behavioral, okay, behavioral because seemingly this may have already the response of the body when it comes to the situations, even for example at the time that the client had been exposed to pathogens. I have introduced to you the concepts of chain of infection and the concepts of periods of diseases. This could be very important, okay, when it comes to when is the time that it started, the onset, or it considered the onset of disease, or the incubation period per se, or probably when to consider the reservoir and consider the portal of exit, going to the portal of entry until the person becomes the susceptible host. Now, on the characteristics, this will identify specifically some of the response of the body, okay, physiologic response of the body, deviations that the body may respond. If these are factors that can be changed, or these are the factors that cannot be changed, which later I will discuss unto you the difference between modifiable and non-modifiable risk factors. Risk factors can be also considered as an exposure. Okay, exposure because this may consider specifically environmental. Okay, environmental, it's either the presence of pollution, hazards, or even occupational exposure. When individuals could possibly exposed to chemical hazards, exposure could be also be considered to a client who have already the diagnosed with the infection, just like in our situations now that the clients are being asked if within the family, within the workplace, have you been exposed with the symptoms, or those clients who have been diagnosed with COVID-19. So these factors are very important, which eventually may risk the client, okay, may risk the client to a certain situation. Just like, for example, in our situation now, why they are asked before, okay, they are asked before if they have traveled to countries that have been identified with high cases of COVID-19. Are there any instances that the client developed symptoms? Are there any instances that the family members have diagnosed with COVID-19? Are there any instances in the workplace that you have been exposed to cases just like COVID-19, just like for those health workers who are basically exposed to this disease, which is the COVID-19. So those informations are very important so that it will give us the direction to answer, okay, to answer the house, okay, how the client developed the signs and symptoms, how you have contracted the disease, how the client experiences the signs and symptoms. So possibly at the start, the client may not have been diagnosed, but it could be asymptomatic and the client could be symptomatic. So that's why we have mentioned even in the COVID-19, there are some clients who have symptoms and some clients who are asymptomatic. But eventually, they could be identified as mild, moderate, and severe. That may consider the degree of the signs and symptoms that we may identify. But very common, even though they are categorized accordingly to mild, moderate, and severe, most of the risk factors are very common. That's why nurses must be guided accordingly uh, to ask the clients on what are the risk factors that are being considered. So that's why it explains that these are attributes, characteristics, and exposure. The one that you are seeing, there's a table that you are seeing as projected in our slide. We have non-modifiable, we have modifiable, we have lifestyle, and we have social. To explain further what are these non-modifiable risk factors, modifiable risk factors, lifestyle, and social. So these are risk factors that you may indicate, okay, that you may indicate in your pathophysiology. Because when you are about to make your pathophysiology, always take into consideration all the factors that could start that could consider non-modifiable. If I enumerated all of this, okay, and you are given the case, you must only depend, you must not put all of this unless the factors that consider the client at risk, okay, of a certain disease or condition is based from your physical examination findings, history, diagnostic examination, that will give you confidence, okay, that will give you confidence to answer. Just like, for example, when you encounter a client, okay, encounter a client who's already 40 years old, 40 years old female, okay, on the demographic profile of your client, we are considering the age and we're considering the gender, who is which is female. Now, these are the factors that cannot be changed. And there are research findings and there are literatures that specifically identifies that a 40-year-old, okay, a 40-year-old population group could be high risk of certain diseases or illness. Why? These are the conditions which mainly may have physiologic changes to female and eventually may consider a possibility of the menopausal stage. If we are considering now a factor of 40 years old as menopausal stage, we are now going to the factors which is gender, which is obviously female. So for the female, we have menopausal stage, we have the we have for the male, which is the andropause stage. Now, according to the research findings and literatures, the menopausal stage or imbalances with the hormones are experienced by the female on the early age of 40s compared to males. So that's why when you are about to consider in the pathophysiology, for example, the table that I'm presenting to you are the risk factors in the development of cardiovascular disease. So when you have a client and your case is 40 years old, look for a literature, do answer the question that will answer the question that do 40 years old will I am I confident to consider the 40 years old as non-modifiable risk factors. You proceed on the literatures and researches that will justify, and there are researches that answers that 40 years old population group and females, okay, females are high risk in the development of cardiovascular disorders simply because that at the early age of 40 years old compared to males, they are experiencing menopausal stage, and in the menopausal stage there could be imbalance in hormones, okay. If there will be imbalance in hormones, what is the problem? Hormones are very significant when it comes to metabolic activity, and metabolic activity is very important for cellular activity. So when it comes to the cellular activity, the cells has electrical charges, and if there are electrical charges, these are the basic physiologic response of the body to basically consider compensatory mechanism. So if the problem with female who may could be considered as on the menopausal stage, and on a menopausal stage it causes imbalances with the hormones, and if there are imbalances in the hormones, there could be a possibility of decreased metabolic response. If there will be decreased metabolic response, there could be a possibility that may affect also the cellular activity. If there will an affectation when it comes to cellular activity, it will affect also the decreased stimulation of electrical charges. If there will be decrease in the electrical charges, there is a delay. Okay, there is a delay in the impulse transmission, a delay in the compensatory mechanism. So that's why there could be instances that for female, okay, for female, it answers now the situation that if a female client who is a 40 years old experiences hypertension, they are considered as 40 years old and female as non-modifiable risk factors because of the condition of the possibilities based from the research findings that these are age population group or population age group that considers menopausal period and significantly affect hormonal activities. So when I will be your panel, I will be convinced if that will be your response. Always take into consideration all the researches that you will do. Every time or everything that you put as risk factors, you must be confident to answer the panel. Because when you consider 40 years old, it must answer the why scientifically. Why you consider the female, so you must answer it scientifically. So, if for example you considered 40 years old for male, if your client is male, and why, and obviously the male is eventually the gender of your client, then look for literatures that why a 40-year-old male could be high risk for the development of cardiovascular disorder, and why males are considered also as high risk of cardiovascular disorder. So probably you may connect the age and the gender accordingly to the lifestyle. Okay, so for example, when it comes to the lifestyle, the males are more engaged into a habit such as smoking, alcohol drinking, that will take risk on the development of the cardiovascular disorders. But if you will try to update yourselves when it comes to the research findings, almost at the level of the same male and female are already engaged into the problems with lifestyle. So that's why you need also to consider the research findings on this. So that's why when I ask you why you consider the gender and why you consider the age as a non-modifiable risk factor. So, and we all know that non-modifiable risk factor cannot be changed. So eventually, this may take into consideration that you will answer scientifically through research findings. Okay? So, another consideration when it comes to the non-modifiable risk factors, go back to your learnings in your anatomy and physiology. There is a concept and principle that are stated that upon the increasing the age, the bulbs of the heart, so you know the bulbs of the heart. So we have different bulbs of the heart. We have semilunar bulbs and we have the atrioventricular bulbs. So in particular, we may talk about the atrioventricular bulbs, which are rather the tricuspid bulbs and the mitral bulbs. So the principle that engage increasing age, the higher the age, okay, the chances that the client could be high risk for cardiovascular disorder, because upon the context and principle of science, in upon increasing age, there will be it causes the thickening, the further thickening of the bulbs, and the bulbs are the one that controls the the blood, okay, the one that controls the blood and the one that will prevent the backflow of the blood. So if it will cause the thickening of, if this is a bulb and it will cause the thickening of the bulb, there will be a difficulty in the opening of those bulbs and may not push the blood from atria to ventricle, and it may cause the retention of the blood. So those are conditions which why a client, okay, you may answer that why the client are high risk of the cardiovascular disorder such as the 40 years old. So you may consider that in the increasing age, there are changes in the anatomical structure of the heart, specifically the valves, which causes a risk for the client to develop cardiovascular disorder. Okay, so another consideration when it comes to non-modifiable risk factors is basically familial history. When it comes to the familial history, you may take into consideration paternal and the maternal, if it is on the father's side and on the mother's side, because we all know that cardiovascular disorders can be, okay, it can be inherited to the children by generation. So that's why upon the continuation of the topics when it comes to the discussion of this framework, I will present to you on the succeeding topics on what are the conditions which we can identify, okay, which we can identify that the possibilities, the higher possibilities and risks that if the parents are having cardiovascular diseases, what are those conditions that possibly the children may also encounter or could consider as health risk. So that will be our succeeding examples. So on the other hand, we will also take into consideration that not all diseases with familial history, okay, not all diseases on familial history must be considered in the non-modifiable risk factor. That's why you must take into consideration, for example, pneumonia cannot be considered, even though with familial history, as non-modifiable risk factors, because scientifically pneumonia cannot be transferred and cannot be inherited eventually as a health risk factor for children or by generation. So there are some such if you will read those books that familiar if they you will ask clients, those who may have diabetes, those who may have hypertension, those who may have cardiovascular disorder, those who may have kidney problems. Those are the examples that when this could be identified in the familial history, chances also the children may develop. And it is better to again use your research capabilities, critical thinking, because if I will be again at the panel, are there any scientific explanation that the paternal side justifies the possibilities that their children will have the hypertension? Very tough question, di ba? Very tough question. So you must take into consideration with that, because there are studies that paternal may transfer some of these health risks to their children. Meron pa there could be a separate study pa, more on the male children, more on the female children. So Usually these are the conditions that are that could be inherited. So in our succeeding topics, I will also take into consideration those conditions that could be inherited, and usually that pertains to the what we call genetic evidences. So by genetic evidences, that's different naman. There are genetic evidences that if, for example, uh, history of the mother may have this condition that will affect their male children. So those are examples. Another for the genetic evidences are those that may have problems with chromosomes. Okay? So for example, if with the genetics you have history of problems with the what you call this autism, some mental deviations. Oh, that's outside chromosomes. This could be possibly be inherited by the children, but it will give you a scientific explanation of who are most at risk, a male or a female. So if your panel will definitely ask you about these questions, hoping you must be ready. Everything that you put as in the risk factors, you can answer it confidently. Another is when it comes to ethnicity. Okay. Ethnicity, when we considered African, Asian, American, okay. So for example, you considered in the ethnicity the Filipino, okay. So for Filipino, obviously under Asian. So there are studies that among the ethnicity, African American, Asian. So Asian are most high risk of cardiovascular disorders. So that can support specifically on the research findings. So other than that, it may support also explanation if the client has previous history of cardiovascular disorder. Okay, wait, sir. Why is it the previous history of cardiovascular disorder had been considered as an unmodifiable risk factors? Just like, for example, if the client already had first heart attack, okay, first heart attack, and that is eventually a condition which is what we call myocardial infarction. So if we say myocardial infarction, myo, we have muscle, cardial, we have the heart, infarction, which is necrosis or tissue death. If there's already identified tissue death, the dead tissue is already there. It may not be replaced by a separate tissue. It already marked there. And there are, as what I've told you during our discussion of diagnostic exam, if you can still remember the biomarkers or isoenzymes that may significantly consider the aspect on the history of cardiovascular disorder or heart attack is through the creatine kinase, specifically the CKMB. So why the client had been tested with CKMB to identify specifically if the client had history of the heart attack, if it could identify already the problem with tissue or dead tissues in the myocardial tissues. So in this situation, just like another example for the previous history of cardiovascular disease, this is eventually non-modifiable, okay? Tuberculosis, okay? For clients who may undergo chest x-ray, for example, why is it that the client may mark in the result of the chest x-ray that tuberculosis, he is negative of tuberculosis, but the physician can still identify the client has previous tuberculosis, because any client who were diagnosed with the tuberculosis, it already marked a fibrotic tissue or tissue death, okay, a tissue death that marked in the lungs. And every time this client will be subject for chest x-ray, it will be seen in the lungs that marked tissue death as an evidence that the client had previous history of the tuberculosis. Okay, so those are conditions which may considered as non-modifiable risk factors. So these are the non-modifiable risk factors. Let's proceed now on the modifiable risk factors. If we say modifiable risk factors, this could be behaviors, this could be attributes, which mainly physiologic response, which could be improved, which could change anytime, which could worse, and these are the conditions which could be controlled. okay, which could be controlled. We may differentiate this into the lifestyle. Don't mix the concept of lifestyle and modifiable risk factors. So, okay, I may set an example of the same. Sir, why is it in the modifiable risk factors, both may have smoking, and in the lifestyle, it also indicated smoking? So, in the modifiable risk factors, we are more considering, okay, we are more considering the effect of cigarette smoke, okay, as a modifiable risk factors. Why? When the client have been exposed to cigarette smoke, it has harmful substances, and these harmful substances, upon entering to the body, the lungs may be affected, specifically the alveoli, and it may cause the the control, okay, it may cause the control or inhibition of the surfactant that may protect the tissues of the alveoli. So but eventually, a client may prevent himself, right, may prevent himself from the exposure to cigarette smoke. This is now how to answer why smoking is also indicated in the lifestyle. We will try to identify in the lifestyle pertaining to a more quantifiable data. Example, do smoking had been considered as habitual, to smoking had been considered as occasional. So this may identify when it comes to the smoking, sir, are you a habitual smoker? So how many sticks of cigarette are you consuming within the day? Will that matter? Will that data matter when it comes to habitual? Yes, because the more sticks of cigarettes that the client are taking, the greater chances, higher risk of percentage that may significantly affect, okay, that may significantly affect the tissues of the lungs. Okay? Although there are situations that the body compensates to protect. Why, sir? Why, sir, that a 12-year-old, I started smoking 12-year-old, but I don't feel anything. At the age of 12 years old, there could be a possibility that the body can still respond accordingly and prevent this. But as it in the increasing age, as what I've told you, there are significant physiologic changes that there will be decrease in the metabolic activity. That's why there could be a possibility that the person who started to smoke on the early age may also develop on the early age problems with the heart and problems with the lungs. So, did you cite the difference on the smoking, if it is modifiable and lifestyle? So again, smoking in the modifiable risk factor will basically consider the how the cigarette smoke affects the body. When it comes to the lifestyle, we're talking about if it is habitual or occasional. Okay, let's go back. As what I've told you, my example is about the cardiovascular disorder. So why do we consider that blood pressure, okay, blood pressure is a modifiable risk factor? Anyone? Anyone in the class? Why modifiable? Why we consider blood pressure as modifiable risk factor? The answer is it's not constant. Okay? Blood pressure may vary depending on the situation. First, do the client has already the pre-existing condition, or is he already identified as having a comorbidity? It means that the client has history already of hypertension. Another is, at the time that the client experiences hypertension, what causes? There are some factors, such as, for example, if the client is very emotional, it triggers also blood pressure because of sympathetic response. The client had been engaged into extreme physical activities that may also contribute to the fact that the client may have increased blood pressure. So this could be improved. This could be enhanced. So if for example, you have you have findings in the vital signs of your case that the client have blood pressure of 160 over 100. Will you consider it as a modifiable risk factor? You can consider it as a modifiable risk factor, but you must have the confidence, okay? You must have the confidence, oh, why you consider the 160 over 100 as modifiable risk factors? Because at that time, with the condition of the client, for example, the client has history of hypertension, and chances that the client miss the miss the taking of the medication, which did not support the to stabilize the blood pressure and leaded to hypertension. Yeah, you can answer the panel that with that. So another is, you must take into consideration also when you answer the panel that you consider the blood pressure as modifiable risk factors. you go back to your foundation on why there is hypertension. Okay, so this is somehow related with the function of the heart and the function specifically of the blood vessels. If there is an increased pressure, this is somehow related to the blood volume. So that will undergo the what we call the pathogenesis, which will be another topic. So when we identify the risk factors, always take the consideration, like when you put blood pressure, don't just put there and enumerate blood pressure, total cholesterol, HDL, smoking. No. When you're about to do a pathophysiology framework, you must have the diagram that when you put blood pressure, how you will connect and give directions that the blood pressure contributes to the development of cardiovascular disorder. The total cholesterol, how you will definitely illustrate the pathway of why it contributed to cardiovascular disorder. When you consider non-modifiable risk factors, why age is considered as non-modifiable risk factors in the development of the cardiovascular disease. So each the factors that you will indicate must have a direct pathway so that it will lead to a justifiable framework why the client have these risk factors and chances that may develop cardiovascular disorders. So all you have to do is you need to be to have the critical and analytical thinking, and it must be supported by research findings, by scientific explanation. That's why every time that I gave you assignments, I always emphasize citations, unless you are the ones, okay, you are the ones who answered the assignment and it is from your own theory. Those that you have answered came from the references and based from what you have learned. Okay, even yours truly as your professor may not claim that this is coming from me. I just I'm facilitating now the discussion of these topics, and I always cite the references because this will be considered as an evidence-based data. Another in the modifiable risk factors that have been indicated here are total cholesterol. So we have HDL. So total cholesterol, HDL means high density lipoprotein, low density lipoprotein. Have you heard about that the low density or LDL is a bad cholesterol and HDL, high density lipoprotein, is a what you call this, is a good cholesterol. However, cholesterol are can be still considered as very helpful in the body because this could be an alternative source of energy aside from carbohydrates. Because once the fats from the cholesterol will be converted into fatty acids, these are an alternative source of energy. However, if the level will exceed and deviate, this is not anymore harmful. So why you consider the level of cholesterol as modifiable? Because it's not again constant. Okay, it's not again constant. It means that this could vary and change eventually upon the condition of the client. This could improve, this could further increase, this may lead kasi upon the results. For example, you have the results of increase total cholesterol. What is in the increased total cholesterol that may cause the chance that the client may have cardiovascular disorder? Okay, think again of the foundation. Basic foundation. Cholesterol is insoluble. Cholesterol is covered by lipoprotein. That's why it's L at the end. The LDL, HDL lipoprotein. It is encapsulated by lipoprotein. It is carried eventually by the plasma. So why is it that LDL is considered as a bad cholesterol compared to the high density lipoprotein? High density, from the term itself, high dense, it can flow. Okay, it can flow freely and may not cause dislodgement to the blood vessels. Why the low density lipoprotein? Because it's low. Okay, it's low dense. Okay, low dense. The greater chances that it may cause the dislodgement to the blood vessel. Once it will cause this dislodgement to the blood vessel, it may cause the obstruction. So once it will cause the obstruction, it may cause the delay in the blood flow. So can this be improved? Yes, this could be improved. So that's why the question is, or why you have considered the results of the increase, you put increase total cholesterol as your modifiable risk factors. First and foremost, the level of cholesterol had been monitored, and eventually the result is increase. Okay, and with the increased cholesterol are suspended in the plasma, and since it is insoluble, it will cause the possibility that it may cause dislodgement to the blood vessel. If it may cause dislodgement to the blood vessel, it may cause the obstruction of the lumen of the blood vessel. If it will cause the obstruction of the lumen of the blood vessel, it may cause the obstruction. If it may cause obstruction, it may delay the blood flow. If it may delay the blood flow, the blood carries the oxygen. It may also, what? It may increase oxygen demand. If it will increase oxygen demand, the cardiac cells will be deprived from oxygen. Thus, the client may have the possibility of developing cardiovascular disorder. That's the pathway. When you put the total cholesterol, that's the pathway that I am expecting in the pathophysiology for you to indicate. That's why also in the succeeding discussions that I will do, I will present to you and you will learn what is the pathway, okay, the pathway in the pathophysiology of when the client has inflammation, if there is cell injury, if the client may have fever, if the client may have hypertension. So that's our pathway. So that if ever you will encounter situations like this and like this rather, and you will indicate these risk factors, you will be aware on how to explain it scientifically on a pathophysiological framework. So another is, as I already mentioned this, that smoking is considered as a modifiable risk factor. Okay, that may answer why again. That you must answer why. And you put in there smoking. Okay, take into consideration there are some cases, or there are some case studies that I encountered that they have indicated smoking as modifiable risk factors, and yet the client smoked once. Will that be considered as a modifiable risk factors? If the clients had smoked once, how can you support that the frequency that the client smoked once could lead the client to cardiovascular disorder? Are there any studies that considering that the client had smoked once leaded to cardiovascular disorder? Don't put it anymore if you are not confident to answer it. Okay? But if it could support with the lifestyle, the client have consumed almost 24 sticks of cigarettes in a day, and for every stick of cigarettes it is composed of 24 harmful chemical substances, and one of which is nicotine. Pak! If you will have this 24 in a day, will you consider also that the 24 times that the harmful substances enters the body? The answer is yes. Then you are confident, include the smoking. So that will give us the confidence to answer. Another is blood sugar. Do our blood sugar are constant? The answer is no. Okay, so it may depend again on the condition. If the client, okay, why, sir, is it considered as modifiable risk factors? Because blood sugar may vary depending on the condition. Example, if the client has already pre-existing illnesses or a chronic disease. If we say chronic disease had been diagnosed before with diabetes, so there is a possibility of chances of increased blood sugar. If the client have results of fasting blood sugar, of random blood sugar, results that are significantly deviated, high or low, that you may consider it as modifiable risk factors. Another question, sir. For example, the father of the client has diabetes. Can we consider also diabetes as non-modifiable risk factors? The answer is yes, because it is enumerated in the non-modifiable risk factors. It's all about familial history. And try to check also if there is scientific explanation that diabetes, if there's familial history, chances that it could be transferred or be inherited by children. Okay? Moreover, if you will have studies pa na if your client is male, if your client is Filipino, and your concept and your research findings are based from this concept, it will become a more strong explanation pertaining to the pathophysiological framework of it. So again, not all familial history must take into consideration as non-modifiable risk factors unless those have been proven that this could be inherited to the children or immediate relative. So another is we have the BMI as modifiable risk factors. Yes, because the weight varies. Okay, the weight varies. It may depend on the situation, because we have the ideal body weight, and the weight matters. For example, actually the one that being considered here as obesity. Okay, so the obesity matters because how you will explain. Class, don't even consider, sometimes you only put in your pathophysiology obesity. Okay, obesity because you have seen the client. You have seen the client with the physical with the physical features. But you did not took the weight of the client and you did not compute for the body mass index. If I will be the panel, how explain to me why the body mass index why the obesity had been indicated there, and yet you don't have you don't have any data of weight, you don't have any data body mass index, then better not to include BMI or obesity as modifiable risk factors if you don't have the data. But it is a must for you as a nurse that once you have considered this as a more holistic approach, then you must take into consideration the weight. Every client, it's very basic to have the information about weight, because the weight matters when it comes to the metabolic response of the body. Do an obese client, based from literatures, may develop cardiovascular disorders? The answer is yes. Okay, now the question is based from your case. Is your client rather obese? Yes, sir. If your answer is yes, then what is the weight of the client? What is the computation of your body mass index? Ayun. So something is missing. Something is missing. So the next is markers of chronic inflammation. Okay. If you put there as a modifiable risk factors, markers of chronic inflammation, uh, plus remember that results of diagnostic exams can be used as modifiable risk factors. All you have to do is to specify if it is increased or decreased. And eventually, I have oriented you in the basic diagnostic exam during our midterm period for you to relate accordingly on how you will use these concepts in the modifiable risk factors. Now, I will ask you, students, for example, if we are considering markers of chronic inflammation in the CBC, complete blood count. What is our marker for inflammation? Is it RBC, WBC, platelet? What is our marker for inflammation? RBC, WBC, platelet. Can I hear answer from the students?
WBC po.
Very good. So aside from that, you may consider also differential count, right? In the differential count, which of the following differential counts may support that the client has inflammation? Monocytes, eosinophils, basophils, or lymphocytes? Which of the following differential count may support inflammatory condition? Because we all know that the W, you have mentioned WBC, could be infection and inflammation. So if it is inflammation, we're talking about possibilities of inflammation. The differential count may help us, okay? May help us to justify, because if I will be the panel, WBC may not be sufficient. I may proceed to the differential count. Then what is in the differential count that supports inflammatory condition of the client? Answer. So the choices again.
Eosinophil po.
Some eosinophils, some basophils, any other?
Neutrophil.
Neutrophils.
Monocyte.
Okay. The answer is eventually basophils. Yeah, basophils. So that's why when you consider, for example, if your case are pericarditis, tonsillitis, all of that has the itis at the end of the case, is obviously we are oriented that it's inflammation. Now, if you have given, if you are assigned to that client with such diagnosis, how can I support a risk factor? So diagnostic exam, WBC, then what I will look for as a support, basophils. Because when you're about to have the direction of your pathophysiology, you will put increase WBC count. Okay, you have considered results of increased WBC count. So what happens next? If you put the indicator at the succeeding part of your framework that the basophil compensates, okay, the basophil compensates on the inflammatory process. Kasi our direction is specifically about inflammation. So will the basophil take part on that inflammatory process? The answer is yes. If you have considered basophils and you have indicated basophils in the pathophysiology framework, if I will be the panel, I will ask you, what is the result of the basophils? If the result of the basophils exceeded or deviated accordingly, then very good. you are confident to answer me that it supports the results of WBC and differential count of the basophils on the inflammatory condition of the client. Then you will explain further what happens after the basophil compensates the inflammatory process. So we are just on the non-modifiable and modifiable risk factors. How about the lifestyle? When it comes to the lifestyle, usually we consider lifestyle if it is habitual. If it happens, if it is if these are activities of daily living of the individual who have been diagnosed with disease. Example, smoking, as what I've told you, could be habitual. Okay? Compared to occasional and habitual client, a lifestyle, a lifestyle change must be advised to a client who are having habitual, more on the habitual rather than occasional, because if we say habitual, the frequency itself may lead to the chance that the client have been exposed to the harmful substances of the smoke, the cigarette smoke. Diet, ayan, diet, usually nutritional management. Usually pag sinabi niyo uh, high high fat, okay, high fat, high cholesterol intake. Don't put high fat, high cholesterol intake in modifiable risk factor, ha. How will you justify it as modifiable risk factor? Always take into consideration that is under lifestyle. Because the client, this is now my ano sa inyo, my question to you. If you will have increased fat in if you will increase fat and cholesterol intake, ha, in the diet, will the frequency be a great factor in the development of cardiovascular disorder? For example, in a week, the client eats high fat foods Monday, Tuesday up to Friday, and the client had the attack. Kasi if we say diet, it's a pattern. Okay? So that's why in a week, for example, in somehow in 3 days, or in 2 days, 4 days, in a week, the client had been engaged into dietary pattern of eating high cholesterol food. Okay, that could be kasi there could be chances that the body did not compensate when it comes to the synthesis of cholesterol. Okay? So, but if you will just consider that the client ate once, will that be a pattern? Will that be a pattern? That may not be a pattern. That may not be considered as a lifestyle. Sometimes when I saw a pathophysiology high fat intake, because the one prior to admission, the client ate rather um crispy pata. Okay. Do the client ate crispy pata? You will ask for the amount. You will ask if the client has existing problems with cholesterol. These are some situations. Then if you're confident to put that the client ate that time as upon the subjective data, ate crispy pata and had the heart attack, then justify it. If you have the confidence to include it in the lifestyle that the eating of the crispy pata contributed to the heart attack, then explain to me why. Explain to me, because the body eventually may have the compensatory mechanism. So, what would be the factors that you may consider it? For example, the client has previous cardiovascular disease, the client is hypertensive, and the client engaged himself in eating the crispy pata. So there's already a factor that I may consider, that okay, that factor could be one, because of the chances that the client's heart may not control the level of cholesterol when it comes to it. So that could be. So, but when you considered it as the client eats crispy pata, and it has a lot of fats and chances that the client develop cardiovascular disorder, the panel may not be satisfied. Okay? So that there must be a consistency of what you're telling to the panel. Next, exercise. Exercise, if you consider the exercise, this is also pattern. That's why if you ask, do you have daily exercise? Is the person did not engage to exercise? Did the person engage into the vigorous exercise activities? Why? Because the heart may significantly have forceful contraction and when the client has this engagement into a vigorous physical activities, and that could be exercise. So that could be part of the lifestyle. There could be also a problem when it comes to lifestyle if the client are not engaging into what? Exercise. That's why diet and exercise are always matched with each other. If you are going to have your diet, then combine it with exercise. If you have exercise, then combine it with dietary management. On this consideration, this will be a validated information, if you're not confident to put exercise as a lifestyle, don't put it. If you don't have the data in your patient history that will justify exercise, don't put it. So probably you may have your research. Actually, you may have probably you may have your research in some of the books. All you may have in your search engines, what are the risk factors of cardiovascular disorders. Okay, if all of the information all of the information could be enumerated, but again, not all those risk factors must be reflected in your pathophysiology. What risk factors could be applicable in your case only. That's why it's a case study. You will focus on your case, not all of those that had been indicated in the book as risk factors. But if all those risk factors are very evident in your records of history, physical findings, diagnostic examination, then pull all of it, because it may eventually consider your confidence to respond on this. Stress is considered as part of the lifestyle. So every time that you considered it as one of the risk factors, these are contributing factors. So another that may be considered as social factors, if you will consider problem with financial constraints, social deprivation, environmental, yan, yung, for example, that's what I told you before. When the client had been exposed to environmental hazards, then that could be on the social, environmental. If the client experiences a problem with mental deviations, then that may specifically consider a problem with social. Okay, social, for example, if there are limitations when it comes to the interactions and the client developmental deviations, then that could be considered as a social risk factor. Another is for income, it's a socioeconomic. Okay, for example, you will mention the the client the client experiences anxiety, and we all know anxiety may contribute to cardiovascular disease because of the sympathetic response. The client experiences financial constraints, unemployment. So that is considered as a social factors. Why? Because the situations of financial constraints may contribute to a problem with nutritional balance. Why? Because there could be a possibility that it may not meet the recommended daily allowance for nutrients, and it may affect specifically the cardiac muscle cells. So these are the examples of why these factors are very important in the pathophysiological framework. And I told you that, as explained further, that the modifiable risk factors are behaviors and exposures that can raise a lower rather, a person's health risk which can be changed. So as what I have emphasized to all of you, modifiable risk factors could be changed, okay, could be modified, could be improved, which is the opposite of the non-modifiable risk factors, which cannot be changed. And I have already enumerated it. So as what I told you, these are the examples that we gave or that we emphasize in the modifiable risk factors. So we are considering obesity, blood pressure, the diabetes that that we are saying is pertaining to the blood sugar. Then the smoking, we're considered it as modifiable risk factors, and at the same time it is considered as lifestyle. Diabetes could be considered as modifiable, and at the same time it could be considered as non-modifiable if there is a familial history. If the client is having problem with the psychosocial factors. So the psychosocial factors that we're considering could be in the social factors, but this could be also a modifiable because this could improve, and the cholesterol itself. So these are the common, okay, the common risk factors. With the risk factors may vary accordingly to the diagnosis of the client. And just like a typical example, why we consider modifiable risk factors: hypertension. Okay, a problem with blood sugar, diabetes, you must have blood sugar, hypertension, you must have a data pertaining to the blood pressure, diabetes, okay, you must have a data that will support the increased blood sugar. Chronic kidney disease, you must have a data that supports, that is not just only subjective, ha. Chronic disease, you may have diagnostic examination that supports and identifies kidney diseases. That's why I even oriented you with some of the diagnostic examinations, di ba? So I oriented you of if there are liver damage, heart damage, kidney damage. So there are tests that have been identified when it comes to isoenzymes and biomarkers. If you can still remember the SGPT, the SGOT. So those are the diagnostic exams. So obesity, if you have data of the body mass index and the weight, abnormal blood lipids, if there's significant increase or decrease in the results of the cholesterol, HDL and LDL. Preeclampsia. Okay, class. These are considered as a modifiable risk factor simply because the hypertension or the hypertensive episodes are happening only during pregnancy. Again, we are not anymore using pregnancy-induced hypertension, but we are already using eventually preeclampsia and eclampsia. And remember that we can only classify eclampsia and preeclampsia if there is results of proteinuria. So that's why preeclampsia and eclampsia are considered as modifiable risk factors because if there is preeclampsia, for example, the client developed cardiovascular disorders, then at the same time, the client is having preeclampsia. So that contributes to aggravating factors that may lead to a further complication of cardiovascular disorders. So that's why it is considered as modifiable risk factors. So eventually, in the non-modifiable risk factors, I have told you that this cannot be changed. So that's why age cannot be changed. Familial history, okay? So try to have the scientific explanation better if you will. It could be better or rather best if you have researches on the paternal and the maternal side. Just like, for example, for cancer, uh, do you know that if, for example, any of the family members, such as the parents, may have cancer, 30% of the siblings or children may possibly have it. So that could be one as having the scientific explanation because 30%. So the higher chance that the client may have if the parents have it. So familiar. So gender. So it will be supported on the scientific explanation of research findings and evidence-based findings. Ethnicity, I have mentioned to you that there is specific ethnicity, American, African, Asian, that supports, for example. Kaya, remember class if you have client who is Filipino, then be consistent that the studies that you will have as a research and as an explanation as as explained when you are about to have the pathophysiology is Asian. So okay, among the Asians, males have the higher chances of hypertensive episodes. So that is a strong support on your findings. Now, these are, as what I have mentioned, have considered just like age, okay? As it increases, ayan, I told you, as it increases the age, cardiovascular disorder is disease, is increase of its risk. So, further explanation of why. It answers always the why. Why there is a high risk of cardiovascular disorders in the increasing age. Then one of the examples that I told you is pertaining to the changes, okay, pertaining to the changes in the bulbs. Okay, another is I have also set an example of the hormonal activities for males and females. So that answers the next non-modifiable, which is sex, or better, more academically termed as gender. Okay, gender. So before the age, men are at greater risk of developing cardiovascular disorder than premenopausal women. The postmenopausal women have similar cardiovascular risk to men. So again, before the age of 60, men are greater risk. But when the females have their menopausal on the early age before 60, the postmenopausal will make them risk for cardiovascular disorder. So that explains. So what is the common denominator with it? The common denominator with it, either andropause or menopause, is hormones. And what is the relationship of hormones? Yan, always ask yourselves, what is the relationship of hormones to cells? Metabolic. What is the relationship of cells in the development of cardiovascular disorder? Compensation to stabilize blood pressure. If the cells will not be stabilized or will not meet the requirements, then the cells will not eventually compensate and eventually may not stabilize or control blood pressure. Okay? So, in the familial history, the risk may be greater if close blood relatives have experienced an early cardiovascular disorder event. So, immediate family members, but there are some questions that you have asked. There is history of cardiovascular disorder on the grandparents, but the parents do not have. Much better that it must be a close relationship, immediate. Okay, immediate, if it is with the parents. But if it is consistent, much better. Uh, uh, this is the study on the genome. We have the grandparents, the children who are their parents also have cardiovascular disorder. Then the children also develop cardiovascular disorder. So that could be a great analysis because it really justifies that it's familial history. Now, so as mentioned in here at ethnicity, individuals with African or Asian ancestry and indigenous population are at higher risk of cardiovascular disorder. Those that I have indicated here as an explanation why it is considered as non-modifiable risk factors are based from the scientific data and sources as well. So that's why when you're about to explain about the risk factors of your pathophysiology, then better do it with these sources. Now, as when we talk about non-modifiable and modifiable risk factors, I know that you have encountered predisposing factors. Okay. When we are about to consider the predisposing factors, always think of what contributed, what uh what are the tendencies. Are there any tendencies that the client may have risk of developing such? So actually the risk factors that we're taking is what we're talking about is to justify the present condition of the client, but the predisposing factors are the risk factors that we are considering of the chances or tendencies, even if it is not existing, but there could be a tendency that the client may have. And these are based from the scientific findings and sources, legitimate and credible sources on why the age group, the gender are very significant when it comes to risk factors when you explain it. Uh, like now you are on the pediatrics, and these are very significant explanation whenever you will use this as for the risk factors encountering by using the age. So, for example, another, as what I mentioned, predisposes tendencies that promote development of a disease of an individual. Example, age, newborn. Why, why there are chances that newborns could be risk for infection? Okay, you may answer it. Mm, why newborns are at risk of liver damage when given with the broad spectrum antibiotics or high level of antibiotics? Mm, why newborns, okay, why newborns are advised to have breastfeeding at the first 2 years of age? Mm, next, why newborns? Okay, why newborns are usually being monitored or are kept warm? Okay, are kept warm, and usually they depend on the regulation of the ventilation when it comes to temperature. Mm, okay. Now, through this predisposed, if we say predisposed, the client could be predisposed to, ayan, the client could be predisposed to infection. The client could be predisposed of liver damage. The client could be predisposed of malnutrition. The client could be predisposed of hypothermia. So, if these are the cases that you have encountered, then this could answer it. If the newborn is high risk for infection because of immature immune system. Yan. Next, why the client or why newborns are high risk of liver damage when given with broad spectrum antibiotics. Remember in the pharmacology, the one that detoxifies the one that obviously a major organ that detoxifies the drugs that are metabolized in the body are the liver, or is the liver, isa lang pala, is the liver, and in association with the function of the kidney. So why there could be predisposed to the liver damage? Answer is the number two. Liver enzymes necessary for detoxification of some substance are often lacking. Another, why most newborns are high risk for jaundice? Why? Why they are being exposed to sun? It's because of these answers also. Liver enzymes necessary for detoxification or liver enzymes necessary are often lacking. That is when it comes to the control of the bilirubin. Okay. So since these liver enzymes are lacking, there is uncontrolled secretion of the bilirubin that may increase in the its secretions or production. So that's why if there is increase in the bilirubin in the blood, hyperbilirubinemia, and we all know that the bile is yellow, and once it will increase its level, it will transfer from intravascular to interstitial spaces. That's why it transfers to the skin. Okay, and it leads to the yellowish discoloration. That answers also in the number two. Okay, so because the liver enzymes are still often lacking. Next, why the next is why the client are being advised to have the breastfeeding on the first 2 years? Answer, because fewer nutritional reserve. Okay? Because the newborns may not may not be capable of nutritional reserves to support the recommended nutritional daily allowance. So eventually, this breastfeeding could be the answer. It could be the answer to support the nutritional reserves. Okay, next, why the client or newborn could be high risk of hypothermia? Answer, because of less body fat to insulate against cold. Okay, if you will notice, why newborns are being placed into the light. Okay, because the client or the newborn may not support his own thermoregulation because of less body fats, and the fats itself are the source also of the regulation of body heat, so which is the temperature. So that's why premature babies are being placed into incubators because of less body fat that may significantly consider in the thermoregulations. Okay, another, how about on the newborn? Then we talk about elders. When we talk about the elders, why the elders are also high risk of infection? It's because, as what I told you, that in the increasing age, the pathophysiologic response of the elders are decreasing. So if there will be a decrease in the pathophysiologic response, there is also a delay in the action of the cells. If there will be decrease in the action of the cells, it will also delay the defense against infection. So that's why the elders are high risk, and that could be justifiable when the IAT considered the elders are the highest priority when it comes to the what you call the vaccination, because of this scientific explanation of decrease in the immune function. Another, number two, the decline in the homeostatic mechanism. Okay, what are the physical features that you may observe for elders? 'Di ba? They lose skin. Usually they are high risk of the problem with posture. Usually they are high risk of anemia. That is the homeostatic, the decline homeostatic mechanism of the body, because of the physiologic changes that happens to the elders. uh the cells cannot anymore regulate the sufficient reserve, just like for the skin. So that's why it may not anymore reserve nutritional reserves for the skin, and it loosens the skin. Another is, clients could call this, the elders are high risk of bone disorders, because they cannot be able to have nutritional reserve of calcium. Okay, because of the delay absorption. So that's why the elders are being advised to take calcium supplements or milk, because that's the source of the calcium. Next, why the elders are high risk for depression, isolation, and even malnutrition. Depression, because again, it could be relatable when it comes to the cellular activity. Again, elders, obviously, menopause. Second, elders may have the possibility of the physiologic change and delay metabolic response. So that's why we all know that the body, rather the brain, are in control of the neurotransmitters, so that it may balance eventually our moods, our behavior, our emotions. That's why, nurses, please try to understand our elders. They do not want to feel that way, because most of the elders may have this physiologic response simply because the cells cannot anymore respond to the extent the same as with you, because of the physiologic change, because of the delayed physiologic response. The cell also may have some imbalances with neurotransmitters such as the serotonin. So that's why they are irritable. Sometimes they may experience depression because they may not be anymore productive. So that's why clients could be, most of the elders isolate themselves because they may not be anymore productive. So those are the answers which can be responded through the physiologic changes. Next po, let us now proceed with the gender, sex or gender. Okay, there are some there are some genders that could be prone to the specific disease or disorder based from the scientific findings. Okay, do you know that do you know that males, are more likely to develop gout? Gout is a disorder, or is a disorder of problem with arthritis. Itis, inflammation, arthritis, joint. And the cause of the inflammation of the joint is brought about by increased level of uric acid. So it means that, based from the scientific findings, the male more likely may develop this may develop this problem with the uric acid. So the next question is, if I will be the panel, oh, how you can confidently claim that males develop more likely develop the gout? So give me an explanation on this. Based from the findings of the 2021, most updated 2021 or 2020, that males are more likely, more specifically for Filipino males, are more likely to develop the gout as based from the studies that were conducted in the last January 2021 among the males, because the level of the uric acid are usually discovered, or are usually resulted into the analysis that the Filipino males may have the difficulty to regulate the uric acid, thus they are high risk for gout. I will be I will clap on that explanation as well. Next, another, males are on 65 years old and above are 39% may have heart diseases compared to 27% of women. So these are basic findings. If these findings of 65 among 65 years old are 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 findings among the Americans, then better have a study of justifiable reasons na among men aging 65 years old for Filipinos. So much better for Filipinos are having 39% of developing heart diseases. So that will give you a justification of why you consider the age and the gender as a predisposing factor. So kaya that's why this could be also a realization for male na in the increasing age, this could lead to the possibility that they may monitor the level of the uric acid compared to women. But I'm not saying that the females or women may not monitor the uric acid. But moreover, because of these findings for Filipino males, they are more likely to develop the gout. Then much better that they must monitor this uric acid level as much as with the number two as findings that they may develop the cardiovascular disease or disorder. So next, here comes another concern for males. Do you know that 50% more men than women may develop Parkinson's disease? Parkinson's disease is a neurological problem which eventually affects the uncontrolled muscle contraction because of the chances of problems with neurotransmitters. Actually, females are more at risk of Alzheimer's disease. Alzheimer's are a problem with the memory, which deteriorated due to the extensive brain starting minimal and continuous brain damage that specifically affects the thought process and the memory. So Alzheimer's are for female, Parkinson's are for male. So just like in the situation that if your family has history of Parkinson's disease, then eventually among the male children could be risk for Parkinson's disease because this could be also inherited. Okay. So moreover, males are more at risk of the following: autism, kidney stones, pancreatitis. Aside from the research findings, scientific explanation may also do. For example, hormones may do. Okay. For example, testosterone may do. Why autism are more considered than men? I will challenge you students that if you consider this as risk for autism, if you will tell yourself, oh, come on, as I cannot anymore change my gender. I could be a high risk for autism. All you have to do is to explore why males are high risk for autism, kidney stones, and pancreatitis. So if you are aware of it, that's a knowledge power. And you can have these citations when you are about to consider in your introduction of your case study and when you're about to explain in your pathophysiology. Let us now proceed with the female. For female, 80% among, these are for Americans, 80% of the estimated 10 million Americans are osteoporosis. Actually, here there are also findings here in the Philippines that among the Filipino women are more risk than osteoporosis than male because of the chances that females have early age on the menopausal, and hormones again has a great factor because this may help decrease the calcium reserve in the bone and may cause the chances of having the osteoporosis. So another is most of the client, this is in the US, that about 55,000 of more women have strokes than men. Oh, so it means that there are factors. So but this may change for Filipino population. Why? Because here in the Philippines, there could be findings that men could have higher risk of stroke than women. That's why when you are about to consider in your introduction in your case study, much better if it is in the context of the Philippines, so that whenever you will consider this as in your pathophysiology, predisposing factors is considered for female who are having stroke, then you may cite the findings based from your introduction. Okay, another for female, women are also more at risk of the following: migraine, urinary tract infection. Oh, we have the explanation why females may have high risk for the urinary tract infection. Anatomical. Why? Because of a shorter urethral canal than the males. Because once the microorganism enters the body of the female and the urethral canal, it can easily penetrate the system with the chances of the spread of the infection. So the client may have the multiple sclerosis. If we're talking about multiple sclerosis, these are neurological problems that significantly cause damage with the nerves. Okay, the part of the nerves are damaged. The myel, the part of the nerve that, and we all know that the nerves are the ones that transmit impulses. So it may delay problems with mobility, possibility of chances that may have the paralysis. Yeah, those are the conditions. Alzheimer's. So that's what I've told you. Parkinson's for male, Alzheimer's for female. On the other hand, genetic makeup predisposed, as what I've told you, if the client's family have problems with asthma, diabetes, so genetically it could be inherited. For stress, class, you could be predisposed to system dysfunction. Why? Because we all know that stress may have sympathetic response and eventually may have decreased immune system function. Why? Because of the release of the cortisol. Okay? The cortisol is the one that basically decreases the immune function responses. That's why most of the clients who may have stress, they are, remember this may also applies to you, to all of you. You could be predisposed to any infection if you are under stress. So please try to cope with it, because the answer with that is because of the release of the cortisol of the adrenal glands. And that supports with the explanation like this. When you're about to consider stress as predisposed factor, if you will notice, the consideration here is when you're stressed, the kidney releases the following, because during the time that in your stress, in stress, there is a sympathetic response. The sympathetic response is the release of epinephrine and norepinephrine. And this is sympathetic response. And this may have an effect on the heart. It may increase forceful contraction. While on the other hand, the adrenal cortex is releasing the cortisol for humans. And the release of the cortisol itself is the one that significantly may decrease the response of the immune system. So that's why, remember, when you're having stress, you are prone to viral infection, to bacterial infection. So this could answer. And we consider stress as part of the lifestyle, right? Because this could be improved, and stress could happen in a daily basis, but you know how to cope with it. So next, predisposing factors is lifestyle. Okay, lifestyle can be considered as predisposing factors, at the same time lifestyle as a risk factor as well. So as what I've told you, diet, exercise, smoking, alcohol drinking, these are lifestyle. But the increased alcohol, if we consider alcohol intoxication, that could be considered na as the effect of the alcohol to the body modifiable. But if we're yung level of alcohol, but if we're considering the habit of taking the alcohol, that may consider as predisposed with a lifestyle. So how about occupation? Occupation are those hazards. It could be noise, pollutants, risk for occupation, risk for the health. Any of these factors in the occupation may consider predisposed. It predisposes the person. Okay, next, pre-existing illnesses. If you're considering pre-existing illnesses, this is what you are hearing about comorbidity. Okay, the comorbidity may lower the body's resistance. Just like if you have heard about the cases for those who may have COVID-19, those who may have comorbidities such as hypertension, and usually those who may have diabetes, usually they are categorized eventually not on the mild. They usually categorize on the aspect of moderate to severe already because of the pre-existing illness. That's why, if for example, if you have diabetes, you're predisposed to COVID-19. That's why that is also the basis of the IATF, why they are being prioritized also. I think they are A3, those who may have comorbidities. in the vaccination program. So that's one. So the pre-existing illnesses could be considered as a chronic illness. And the chronic illness are the ones that may possibly na, if the client may have chronic illness, all you have to do is to monitor the chances of complications. Okay? So next, environmental. Environmental exposure, so we have considered it as a social, okay? However, the environmental exposure that I'm telling you here is you could be predisposed. You could be predisposed if you have prolonged exposure to cold. Why? Predisposed to what? Do you know that you are predisposed to heart disease if you have prolonged exposure to the cold? How you can answer that? Scientifically, the cold may cause vasoconstriction. How about prolonged exposure to heat? You may have the chance or the possibility that you may have high risk for heat stroke. Why? Because too much exposure of the heat may increase the sympathetic response of the body. And with that sympathetic response of the body, the client may increase metabolic rate, increase the perspiration itself as a fluid loss. And the fluid loss may cause electrolyte imbalance. And the electrolyte imbalance itself could be an evidence that may lead the possibility of the heat stroke. Another is exposure to allergens. For example, if the client's environmental exposure has history of asthma, okay, you will be told you are predisposed to asthma attack if you're exposed to allergens such as pollutants, such as dust. Long-term exposure to sunlight, this could be, as what I've told you before, this could be predisposed problems to autoimmune diseases. Those who may have lupus, those who may have HIV, those who may have other autoimmune diseases, kidney problems. So another is too much exposure to sunlight may cause the possibility also of skin problems. So you are predisposed. So that's why it is advised you that, okay, when you are about to have exposure, it's only morning up to 10 o'clock because the UV rays itself may cause the possibility of too much problems that may inhibit the cells to respond and to compensate because of the chances of dehydration of the cells. For long-term exposure to occupational chemicals, so hazards as well may cause the possibility as they are predisposed. So the last topic before you proceed to your self-assessment exercise, anyway, it will be a 1 hour naman, 10 items and matching type. So, etiologic factors for mental deviation. Oh, sir, why you are introducing now the psychiatric nursing? Because it's not only the medical surgical nursing on concepts are being considered in pathophysiology. So that's why I will also introduce to you the factors that being considered when it comes to mental deviation. This is very timely nowadays because of our situation. Now, etiologic factors that may consider mental deviations: biological, psychological, and social factors. So when we talk about biological factors, these are situations or factors that basically consider the body's response. Okay, the body's response that could be related to mental deviations. Example, biological factors, genetic. Okay, mental deviations could be inherited. Okay, so that's why when you are about to make a pathophysiological framework when it comes to mga mental deviations or maladaptive behaviors, you will use this as a guide to ask the relatives and the clients themselves. Next, biochemical alterations. What do you mean by biochemical alterations? Biochemical alterations, these are related to neurotransmitters. Okay, and usually the neurotransmitters such as the serotonin and dopamine matters. And if there are findings specifically that are related to it, these are biological factors. Infection. When it comes to infection, if the client have the previous infection such as meningitis, that is directed to the brain. Any other infection that affects the brain other than the meningitis or encephalopathies, these are the infections that cause damage to the brain. So, it may lead to the mental deviation. Intoxications, alcohol, okay? Alcohol intoxications or intoxication because of increased level of alcohol may cause mental deviations because it alters the neurotransmitters in the nerve cells, the cerebral cells. Brain damage, for example, congenital problems, hydrocephalus, or anatomical congenital problems. This may lead to mental deviation. So those are factors. Vascular causes if the blood vessels of the brain are affected. Perinatal causes if there are congenital disorders affecting the nervous system, specifically the central nervous system or the brain. So those are conditions that can be considered as biological. Now we can consider psychological factors. When we're considering psychological factors, these are the following. maternal separation, so parent to child, abnormal parent-child relationship. What do you mean by abnormal parent-child relationship? If there are no open communications and it causes gaps with the parent and child relationship, these are psychological factors. Marriage problems, stress, season. Okay, the why season is there as psychological factors. A typical example is in Norway. Can you imagine in Norway that they do have shorter daytime compared to us here in the Philippines? Can you imagine at 3 o'clock in the Norway, it's just already a dark a dark sky and environment. Seemingly that 3 o'clock is already evening in Norway. So can you imagine that they have a shorter span of time for social interaction, for physical activities, so that's why they may have mental deviation. So the season could be one as psychological. Sexual difficulties and low self-esteem. Psychological factors dito, the one that you will consider, class is mental deviations if it affects self-actualization and self-esteem. Always take into consideration the Maslow's hierarchy of needs. In the social factors, if the problem is physiologic needs, such as poverty, or it may not meet nutritional, okay, unemployment, finances, it may not meet nutritional, urbanization, alcoholism, these are social factors because environmental din yan. If you are exposed to situations that most of the neighbors or the people are drinking, then you go about it, you trend to join with them and mingle with them, so that may trigger it. Broken homes, religions and traditions that somehow deviate you to some of the nutritional needs. So these are biological. So we may now differentiate for the last 3 slides. We may now differentiate predisposing factors, precipitating factors, and perpetuating factors. When we talk about predisposing factors, I have already explained this to you that those who may have tendencies, the key word here is contributed. What have contributed to the person's problem over the lifetime. Kaya that's why when we talk about the age, okay, it cannot be changed. So that's non-modifiable risk factors. But I have mentioned to you the age and the gender as the age and the gender of what age group may have the cardiovascular disease, what gender could lead to the development of Parkinson's, Alzheimer's, osteoporosis, cardiovascular disease. So genetic. Intrauterine factors, this could lead to the possibility of obstetrical history and may lead to the possibility of the congenital disease. Chronic diseases, so these are diseases for long over time, so na they are already diagnosed. Early life adversity. If you say early life adversity, I know you have studied in your pediatric nursing that yung stages of development may require appropriate needs that may meet within those stages. However, if they are deprived with this needs on these stages, the early life adversities could be a risk in the development of problems in the future. Just like even in situations like right na do you have a problem in your childhood, and that may also predispose to his present condition, why he or she had been diagnosed with such mental deviations. Okay, how about precipitating? For precipitating factors, all you have to do is to remember the key term trigger. Okay, contributed, tendencies for predisposing. For precipitating, trigger. Any factors that will trigger the start, kasi it's the onset, the start of illness or cause related behavioral response. So an example of this is physical. Trauma, okay, trauma, infection, intoxication, may trigger to a certain disease. Example, trauma. Trauma may trigger to behavioral response. Infection may trigger complications, okay, complications to the different system. Intoxication, such as alcohol or any toxic agents that may enter the body. Intoxication may trigger also organ failure. So those are the ones that been considered as precipitating factors. For psychological conflicts, example, frustration, bereavement, the common denominator here is if the client has an ineffective coping mechanism, and that may trigger to a higher level of anxiety. It may trigger possibly depression. So those that you can direct na if the client may have a psychological concern that she is experiencing. Kasi, di ba remember we have the dabda? A person may not follow through this dabda. The client may have denial, at the same time, may have immediate acceptance. However, if the client may have this dab and the person may stop on a certain level of bargaining and anger. So these are the chances that may trigger, okay, that may trigger situations. Epidemic health concerns. So when it comes to epidemic health concerns, if we say epidemic, it's on the local. Pandemic is global and including the local. So if we say epidemic health concerns, this may trigger specifically communicable and infectious. So this may infect anyone. So why sleep deprivation may trigger? Or remember ha, when you are deprived of sleep, it may trigger problem with immune system. If you're deprived of sleep, may trigger mental focus. If you are deprived from sleep, it may trigger specifically thought process. So that could will trigger. Trigger meaning it may cause. Yeah. Physical restraints and sepsis is infection. Okay, for the last slide, perpetuating factors. These are situations. These are sometimes that I'm not seeing in the pathophysiology. Any factors which maintain negative symptoms of an illness and condition. All of us have certain decisions that sometimes we depend on what we believe in. So, example, it maintains the negative symptoms. Resources are available. You have been oriented of what to do, but sometimes you refuse to do it. You ignore of doing it because you have certain beliefs that causes aggravation of the situation. Example, harmful illness beliefs. So we all know that there are some beliefs before that okay, you may not consult primarily the doctors because they may not explain this. Arbolario will do. Okay. Negative health habits. Okay, negative health habits, for example, you may not eat at night. Okay, you may not eat at night because the chances that it may trigger, it may cause this effect to your body. So those are negative health habits that holds you towards the health solutions. Misinformation, this is one. Okay? Sometimes the misinformation is the one. Okay, that's why it's a great factor that if you ask the person, do you know that the your exposure? No. Yan, you can use this as perpetuating factors, misinformation. Social support factors, if for example, the person are not being supported by the family or by the significant support when it comes to his beliefs, yon. So he stand on his own his point of view when it comes to this. Chronic illnesses are considered as perpetuating factors because sometimes uh the person may believe that there's no cure anymore. So that's why this is holding the person to contribute to such diseases, to such recovery or rehabilitation. So those are perpetuating factors. So any questions so far? Any questions, students? Okay, if none, so thank you very much. I will end up my recording of the